Fibromyalgia, also called fibromyalgia syndrome, is a long-term condition with widespread and generalized musculoskeletal pain all over the body and consequent disability. Fibro means fiber and myalgia means muscle pain. It is the most common chronic diffuse musculoskeletal pain syndrome. Epidemiology of fibromyalgia. Fibromyalgia occurs in 3 to 10% of general population. Women are more affected than men. The ratio is 10:1. Most frequently develop in the age group 20 to 50 years. Its incidence increases with age and reaches a peak of 7% in women aged over 70 years. Pathophysiology of fibromyalgia. The exact cause of fibromyalgia is unknown. Fibromyalgia is not an autoimmune or inflammatory disorder, but current research suggests an involvement of the central nervous system. It is thought to be related to an abnormal increase in levels of certain chemicals in the brain that signal pain, and changes in the way the central nervous system processes pain messages carried around the body. Several hypotheses have been developed, including central sensitization. This theory suggests that people with fibromyalgia have a lower threshold for pain because of increased reactivity of pain-sensing nerve cells in the spinal cord or brain. Some associations and precipitating factors for fibromyalgia. Genetic association. It may be inherited from families. Certain gene mutations may be responsible. Infections such as hepatitis C, Lyme disease, Epstein-Barr virus infection. Physical trauma leading to post-traumatic stress. Psychological or emotional stress. Clinical features of fibromyalgia. Generally, fibromyalgia can be presented as widespread chronic pain more than 3 months, usually on the back and neck. Extreme tiredness or fatigue, mostly in the morning. Unrefreshing sleep. Mental disturbances, which is also known as fibromyalgia fog, fibro fog or brain fog. The features of fibro fog are memory lapses, difficulty concentrating, trouble staying alert. Other psychiatric presentations are depression and anxiety. There are certain locomotive symptoms of fibromyalgia. For example, early morning muscle stiffness, feeling of swelling in hands, and distal finger tingling. The non-locomotive symptoms of fibromyalgia are headaches or migraines, irritable bowel syndrome, irritable bladder, allodynia, which means pain in response to non-painful stimuli, hyperesthesia, which means exaggerated perception of pain in response to mildly painful stimuli, and frequent side effects of drugs, which is also known as chemical sensitivity. Diagnosis of fibromyalgia. There are no specific laboratory tests for fibromyalgia. Certain routine blood tests or imaging is done to exclude other conditions. Mostly the diagnosis is clinical, which is based on history and physical examinations. Fibromyalgia can be diagnosed by exerting pressure of 4 kg per meter square on 18 small spots, each about a size of penny, located throughout the body. These spots are known as tender points. For the diagnosis, pain in 11 out of 18 tender points are required. 4 kg per meter square pressure is roughly the amount of pressure that will cause slight bending of the thumbnail. Some differential diagnoses of fibromyalgia can be Lyme disease, hepatitis C, HIV infection, rheumatoid arthritis, SLE, Sjogren's syndrome, ankylosing spondylitis, polymyalgia rheumatica, peripheral neuropathies, multiple sclerosis, myasthenia gravis, hypo or hyperthyroidism, Cushing syndrome, and diabetes. Management of fibromyalgia. The aim of the treatment is to educate the patient about the condition, address unresolved psychological issues, achieve pain control, and improve sleep, reduce symptoms, and improve quality of life. Currently, there is no cure for fibromyalgia. It requires a multidisciplinary approach which includes rheumatologist, neurologist, and psychologist, and a combination of medication and lifestyle changes. Certain pain relievers can be used, such as tramadol, aspirin, ibuprofen. Certain antidepressant drugs can be used, such as amitriptyline, doluxetine, and milnacipran. Some non-pharmacologic therapy of fibromyalgia, physiotherapy, can improve strength, flexibility, and stamina. Long-term graded exercise, aerobic and strength-based exercise, cognitive behavioral therapy, and complementary therapies such as massage, acupuncture, and chiropractic manipulation. Prognosis of fibromyalgia. Fibromyalgia can last a long time, but it neither results in tissue damage nor it is an organ-threatening disease. The prognosis is variable. Some patients with fibromyalgia continue to suffer from long-term widespread pain, while others improve within a few months. If you want to read the full fibromyalgia article, then please visit our blog. The link to our blog is given in the description. If you want to watch more videos like this, then hit the subscribe button, like this video, comment and share. Thank you.